Namaste, I'm Dr. Shanti Radhakrishnan. I'm an administrator at this wonderful premium cancer care hospital, that is Apollo Proton Cancer Center. Recently, my father was hospitalized and he had to undergo a major surgery. He's 87 years old and also a long-term diabetic. So I was really concerned about the post-operative care, taking him home and giving him care at home. So that is when I found Life Science Solutions. Earlier, when I was studying medicine and all, we never had this kind of remote monitoring happening for a patient who's taken care of at home. But now, thanks to this technology, I was able to do my work at the hospital and still keep track of what were my father's vital signs. This technology helped me to be at peace while at work and also assist my sister, who was the immediate caregiver there, feel safe and secure that somebody else is also monitoring. So apart from the access that I had to all my father's vital signs, that is their heart rate, the respiratory rate, the BP, the temperature, and the SpO2. So what more can I ask? So when I had this access with me, I could tell my sister, see, everything is fine, Appa's doing well, so don't bother. And I also had the wonderful team at Life Science Solutions remotely monitoring the same thing, and I used to get the alerts. Of course, I didn't want to give my sister any kind of anxiety, but whenever I had this alert of the heart rate is high or the respiratory rate is high, I could ask my sister, what is Appa doing now? He was being probably given a bath at that time, or he was being exercised. So I could know that these alerts were okay at that time. So this gave me immense peace of mind, and my folks at home were truly grateful for this innovation. In my maybe 35 plus years of experience in the medical field, this sort of innovation is most needed for our growing population of vulnerable citizens, that is the geriatric population, the people who are bedridden for maybe sort of neurological deficiencies, or for very critical illnesses like cancer, and those who are at home just because they are just being monitored and sick, bedridden for various reasons. Post-operatively, people have had fractures and immobilized for about a month or so. So all these people, if it's like having a nurse at home by the side, having a monitor at home by the side, bedside. So I find the solution to be practical, implementable across all population groups. This is my personal experience, and since I work in a hospital, I also have first-hand experience of the same thing happening with some of our patients who are immobilized for longer periods of time. So this helps our nurses also a little break. They can monitor from sitting at the nursing station, and when the alerts are raised by the third team which is sitting in a remote location, they can identify whether any intervention has to be done or not, or whether it is okay to have that alert. I wish that this was found sooner and we had this solution earlier for a lot of our population. This is my practical experience, and I really wish that a lot of people will adapt to this, and it gives the clinicians and the caregivers much peace of mind. Thank you.